My name is Marina Rodriguez, and we are so excited to have the opportunity today to address a topic near and dear to my heart as current network director of a staff family childcare network. Over the past 15 years, I have had the firsthand experience of partnering with family childcare educators, from supporting new providers to get licensed, to educational coaching, to engaging in transformative groups. So I know how powerful it can be. But I hear these words being used to describe a lot of different things. I'm excited that we have the chance to hear about this topic from three experts: the leader of a nationally recognized family childcare organization, a nationally recognized researcher in the field, and an amazing family childcare educator. In this conversation, you will notice that we will use both terms, provider and educator, interchangeably to refer to family childcare entrepreneurs. First up, I'm pleased to introduce Jessica Sager, a longtime friend, co-founder and CEO of All Our Kin, a nationally recognized nonprofit organization that trains, support, and sustains family childcare educators. Hi, Jess.
Hi, Marina. Hi, good to see you.
Same. Jessica, All Our Kin has built and runs staff family childcare networks in multiple cities and states over the past 20 years. Can you tell me what a staff family childcare network is and why it's important?
Yeah, Marina, it's such a pleasure to be here with you today discussing this important topic. Let me start by talking a bit about why family childcare is so important. Our childcare system, as we've seen so clearly in recent months, is extremely fragile. Even before the pandemic, we didn't have an adequate supply of childcare to meet the needs of children and families. Educators have been underpaid for years, and families lack access to continuous, stable care. Family childcare providers play a critical role. They offer that nurturing, continuous, quality care to children and families, especially families with infants and toddlers, families working non-standard hours, and families with barriers to accessing care. But family childcare programs operate on really thin margins and often lack access to professional learning and peer development opportunities. Even before the pandemic, family childcare programs were closing at an alarming rate. There's a lot that we need to do to better support these educators, and staffed family childcare networks are one key strategy. They can't fill all the gaps in our system, but they have an important role to play in making sure educators are supported. Family childcare educators, like all professionals, need access to training, resources, and peer mentorship. That's what an evidence-based family childcare network provides. Through coaching, group professional learning, and opportunities for connection, a network supports family childcare providers as educators, business people, and leaders, bringing the best of what we know about how children and adults learn, providing opportunities for peer mentorship and connection, and recognizing the unique role that family childcare educators play in supporting children and families. At All Our Kin, we've seen firsthand the difference that staffed family childcare networks can make for children, families, and educators. We've seen the impact on the supply of childcare, which leads to more equitable access for children and families. We've seen the impact on provider earnings and business sustainability, which leads to greater compensation for our critically undervalued workforce. And we've seen the impact on the quality of children's early learning experiences. That's why we care so much about this topic and why I'm so happy that we're having this conversation now.
We are very fortunate to have with us today one of the leading researchers on family childcare in the country, Toni Porter from Early Care and Education Consulting. Hi, Toni. Welcome.
Hi, Marina. It's so nice to see you.
Same here. Toni, can you start us off with the A definition for family childcare networks?
Sure. I think it's going to show on the screen right now. And so Our definition from the National Study of Family Childcare Networks is that family childcare networks offer a menu of ongoing supports to a targeted group of home-based childcare providers. Services include visits to homes, training and professional development, and peer support through a qualified specialist.
Why are staff family childcare networks important?
We know that family childcare, regulated care that a provider offers to a small group of children in her own home, is the most common childcare arrangement for young children, particularly for infants and toddlers from underserved communities. We also know that there has been a significant decline, 42%, in family childcare supply over the past decade. Our national study of family childcare networks shows that networks are a promising strategy for building and sustaining family childcare supply and for improving quality. Because networks support many providers of color who also serve many families of color, they have the potential to redress the pervasive structural inequities and systemic racism that many providers and families experience. Networks that are embedded in the community can build on family childcare providers' strengths and resources through culturally responsive and sensitive services that are specifically intended to support the unique circumstances under which these providers offer care.
Wow, that's powerful, Toni. How do networks build family childcare supply and improve family childcare quality?
Our research shows that family providers face some common challenges, and Marina, you're familiar with probably all of them. Many providers go into this work because they love children and want to care for and educate them, but they often lack essential skills for operating a successful small business. Networks offer coaching, training that help providers with record keeping, marketing, budgeting, and often collecting payments from parents. These services help providers generate a sustainable income. Family childcare providers may interact with multiple systems that have consequences for non-compliance, violations that can put their license in jeopardy, loss of subsidy payments, inability to take advantage of quality rating and improvement systems. Networks help providers navigate these complex systems and the paperwork associated with them. One of the unique features of family childcare is that providers care for mixed age groups, infants and toddlers, preschoolers, and school-age kids in the same setting. Individualizing care for children in these different age groups can be daunting. Networks offer visits that are grounded in relationship-based practice, which honors trust, reciprocal respect, shared goal setting, and cultural values and beliefs. These visits strengthen provider practice and enable them to support children's development across the domain. Providers' working conditions are really hard, and we're all familiar with that. They care for kids 10, 12, 14 hours a day. They provide childcare in the same space that they use for their own families, and they play multiple roles as teacher, business administrator, cook, and janitor. Plus, they care for their own families. Networks offer peer support and peer mentoring. These opportunities for providers to share their experiences can contribute to increased social support and self-efficacy.
What does the research tell us about the most effective practice of family childcare networks?
This is such a good question, Marina, because the evidence of network effectiveness is really slim. There are only a handful of studies that link network services with improving quality and business sustainability, and the All-Our-Kin evaluation was one of the few of them. We also have virtually no research that shows impacts of networks on child and family outcomes. But research shows several practices that are promising. Frequent, and I mean monthly or more visits that focus on quality rather than monitoring, ticking off checklists. Interactive training that uses adult learning principles that is tailored to providers' language, educational backgrounds, and culture, and that is offered at times, in places, and in formats that facilitate provider participation. You and Jess discussed provider-to-provider peer support. Now, there's some evidence that shows combinations of these services, coaching combined with training, for example, makes a difference, but we don't know how that works in networks. And equally important, we don't know whether one network platform, a standalone network like All Our Kin, or a child care resource and referral agency, or an early Head Start child care partnership program is more effective than another.
Jessica, would you help us understand how the All Our Kin Staff Family Child Care Network brings this research that Toni spoke about to life?
Yeah, so All Our Kin is an example of a staffed family child care network run by a standalone nonprofit. We built our holistic approach over time through 20 years of direct experience running networks in partnership with family child care educators in Connecticut and New York. As I described earlier, we've seen firsthand the impact that staffed family child care networks can have on the well-being of family child care educators, of families, and of children. We are very proud of our work at All Our Kin, but I want to be really clear. Ours is not the only model for doing this work. Just like in early childhood education, there are many right ways to build a staffed family child care network, and many agencies, as Toni described, can play this role. These agencies can be child care resource and referral agencies, early Head Start child care partnerships, family child care provider associations, and many more. However, our own learnings and the research of scholars like Toni have shown us that there are some critical components and core values that are essential to creating a network that truly values and supports educators and children.
I really appreciate the many right ways because we know communities are experts in their own context. I appreciate you naming that. But based on your experience, what are the critical components of a network that you recommend other groups focus on?
That is a great question that a lot of people are asking right now. So we have actually created a graphic to help summarize it. Could we bring it up? Great. So the first thing is, we believe that you need to have a vision for engaging and serving family child care educators. You have to have a plan for what you want to accomplish in partnership with educators, including how your network is going to transform outcomes for educators, children, families, and communities. The next, guiding principles and values. These need to be integrated into all aspects of the network. In fact, we believe equity and the other values that we outline here are so essential that we've put them in the center of our graphic, grounding in a strength-based, relationship-based approach that values educators' work and the dedication that they bring, centering equity for children, families, and educators, and elevating educator leadership and making sure that educator voice is centered in everything that you do. Next, holistic and responsive programming. We know that educators have to wear so many hats and play so many roles. Network programming needs to reflect this. We need to support educators as educators and also as business people, giving them the tools to succeed in these and the many other responsibilities that they hold. We also know that adults, like children, learn in different ways. And so offering learnings in a variety of styles, from one-on-one coaching to group learning opportunities to, above all, peer mentorship and support, and providing opportunities for educators to access this training, offering it in multiple languages, at convenient locations, and at times of day that actually work for educators' lives. Next, supportive funding and policies. Networks don't exist in a vacuum, and there's so much that policymakers can do, from paying subsidies that reflect the true cost of care to supporting and investing in professional development for family child care educators. Networks can also play an important role in conveying information to policymakers about what educators need. So that is, not only can networks convey the latest news and policy to educators, but ideally they are also reflecting back to policymakers what educators know from their work directly on the ground. And finally, knowledgeable and dedicated staff that actually reflect the communities that they serve, that have deep knowledge of how adults and children learn, and are committed to honor and value family child care, maybe have worked in it, understand why the work is so important, why it is so hard, and are committed to this relational way of partnering with family child care educators.
It is my pleasure to introduce my friend and colleague, Natasha August Williams. Natasha was the owner and operator of Sweet Pea Home Daycare for 8 years. Natasha will share her unique perspective as a family childcare educator who worked with the All Our Kin's Bridgeport network for years and who is now on the All Our Kin staff as a provider mentor and educational coach. Hi, Natasha. Thanks for being here.
Hi, Marina. Thank you.
Natasha, how did your journey begin, and what kinds of engagement did you take part in with the Family Childcare Network?
Thanks, Marina. That's a great question. About 1 year into opening my business, I opened in 2010. I saw many mailing about All Our Kin, but I had no idea what All Our Kin was. There was no Google at the time. So one mailing that caught my eye was Birth to 3. So I decided to attend that training. Over the following 7 years, I took advantage of many opportunities through the network, including completing my Child Development Associate, CDA, a 10-week Circle of Security group based in attachment theory, workshops in marketing, and worked to achieve my accreditation through the National Association Family Childcare and more. I also had leadership roles such as serving on the board of All Our Kin and being a part of the provider steering committee that gave input on ideas for the network and for state policies.
Those were lots of engagements. How did your practices as an educator change through this relationship with the network? What was the impact that it had on the children in your care?
Through the network, I worked with an educational consultant, and together she came into my program and she helped me develop we had a strong relationship, and she helped me develop different strategies to how to teach the children. I had an approach from my country where it was more teachers led, and she taught me to be more engaged and have the children lead. And one example that really touched me was an art example. I remember buying expensive materials, and I used to give the children coloring pages, but it used to frustrate me because they will not color just a few lines, and most children would turn it on the other side and draw on the plain lines. And she showed me to give them plain paper. And that was my aha moment when I realized that all the different art projects were different. It wasn't uniform on the wall, and the children were happier to do art. When it was art time, everybody rushed to the table. There was no tears. And I thought about it. I'm like, wow, I spent all that money on expensive material and just letting the children be themselves really was less stress for me, and I have happier children.
That was a very powerful example. Thank you. How did your practices or how did your practice as a businesswoman change through this relationship with the network? What was the impact that this had on your program?
One of the impact that really touched me was when I attended the 10-week business series. It really helped me had a stronger contract. It had a handbook for the parents because I didn't have a handbook. Setting up my prices, having policy, how to file for taxes, and having a website. I was having trouble getting payments from parents because I had more of a friendship relationship, and that didn't quite work. My mentor at the time was Jen Murray, and she taught me that it's a business. You're running a business, and having that mindset change from a friend to a business owner, I actually started enrolling more children where I opened a second program, which my mom was running on my first floor because of changing the mindset of that. And it really put a shift in my head that this is just not having a daycare, but this is an income for my family. And really going through the business series is really touched me because with the network, when you go through the series, they have a consultant who comes to your program every 2 weeks and really help you through it. Without the network, I wouldn't be a business person. I don't think my program would stay open.
Yeah, that's really powerful. It sounds like you were really empowered through these experiences as a woman and as an entrepreneur woman. So, well, thanks for sharing that. Prior to the COVID-19 pandemic, you were actually hired by the network to be a provider mentor and educational coach. Can you share how you and the network supported providers and families during the pandemic?
This is another great question because we never experienced anything like that. And I enjoyed going to programs, helping with curriculum, helping setting up spaces. And all of a sudden in March, we couldn't do that anymore. And we had to shift everything. And I had a lot of educators who called me not because I work with the network, but because I had the experience. They look at me as a peer, and I'm like one of them. So I had to put on my educator's hat to really help them. The network was amazing. They provided mental health support for a lot of educators because it was a stressful time. They had to deal with the family. They had to also take on 9 children and teach them. And they had some of them had a lot of financial hardship because parents couldn't work. So they lost a lot of kids with their enrollment. And the network stepped up and we had mini grants for them. So the educators really was happy for that. Also, with the network, with all our kin, they helped deliver PPE because it was hard to find cleaning supplies. It was hard to get masks, and all our kin put it together where we as coaches went door to door and really drop off materials for the educators so they could have their doors open because they can't leave the program and stand in line to get those supplies. So it really helped them a lot, and they really appreciate that. And as a network staff, I had to change a lot. We all had to. We had to do more Zoom in person, so we had to figure out technology. A lot of educators, they couldn't figure out the technology part of it. So we had to do one-on-one over the phone or over to Zoom to show them. So we were learning. It was challenging for them, but challenging for us. And we really helped them. And now we're doing Zoom.
Hearing these 3 perspectives, I could really explain what a staff family childcare network is and the important role it plays for educators. To wrap up, I'm wondering if each of you could leave our listeners with your top recommendations related to staff family childcare networks.
Thank you, Marina. I have 5. The first is that policymakers should recognize and honor the unique features of family childcare. Second, networks should be fully committed to family childcare with specific goals for supporting this unique sector of the early childhood workforce. Providers should be the network drivers, their voices should be at the center, and staff should have the knowledge and skills to be responsive to providers. And as a researcher, we need more research, implementation studies, and evaluations to provide the evidence we need to move from talking about the potential benefits of networks to demonstrating their success.
Great question. My top recommendation is to keep in mind that a network exists to serve family childcare educators, and that means that in order to be effective, networks must be shaped and led by the recommendations of the family childcare educators that they are designed to support. Effective networks have staff that honor and value educators' difficult and important work and build authentic, meaningful relationships with them. They adapt their programming to meet educators' changing needs, and they continually revisit their offerings to ensure that their services are inclusive, equitable, and welcoming to all educators and families.
Thank you, Marina. Family child care providers wear so many hats at the same time. They're an educator, they're a chef, they're a nurse, they're a business owner, they're a family worker. And we often do it for little pay and long hours. We care for children during the most important years, and we do it for love. A network can recognize and support all of those hats and recognize that we are not babysitters.
A heartfelt thank you. Thank you so much to our experts and also to our listeners for engaging on this important topic.